Good morning. I'll just, right before we start, it looks like Jesse McPhail has already started the recording. So thank you, Jesse. Jesse will also be monitoring the chat. So if you have any questions while the speakers are presenting, please go ahead and drop them in there, and Jesse will let us know. And so this is the breakout session for Healthy Acadia and AMHC around new supports in the county, in Washington County, for people impacted by substance use disorder and other mental health concerns. I'm Marcia Sloan. I'm the Director of Family Futures Down East, and I want to welcome Elsie Fleming and Clem DeVoe. If you just want to both introduce yourself for a second.
Hi. Hi, I'm Elsie Flemings, Executive Director of Healthy Acadia, and strong collaborative partner with AMHC and Clem. So Clem, go ahead.
Sure. My name is Clem DeVoe. I'm the Program Director for Behavioral Health and Integration in Washington and Hancock counties, and very, very excited to be here. Actually, thought it was really interesting when obviously both of our organizations were asked to share some information. So again, strong partner with Healthy Acadia and many other wonderful organizations that are here today. So
great. So obviously, Washington County has continued to have challenges around substance use disorder before the pandemic, and some have increased during the pandemic, and it's been harder for folks to access mental health and treatment supports, and this impacts a lot of people in our communities, our friends, our family, and the workforce in Washington County. So I'm going to give both Clem and Elsie a chance to talk about some new and continuing initiatives that both their organizations are going to be working on, and then we'll have a chance to kind of come back together and talk about other needs and how it impacts the community. So we'll start with Elsie.
Great, thanks. So I think we decided we'll do a little bit of a tag team on the overview part, which should hopefully we'll have a flow that makes sense. I will start here with a couple of our bigger initiatives around prevention, community prevention, and then Clem will talk about big initiatives around treatment, and then it'll come back to me around some recovery initiatives that in collaboration with so many partners, the AMHC and other partners. So we are in still in the early years of a 5-year grant with SAMHSA, the Substance Abuse and Mental Health Services Agency, part of Department of Health and Human Services at the federal level, and specifically around community prevention. And we based this program I don't know if some of you are familiar with people sometimes call it the Iceland model of prevention. There was a longitudinal, significant work for about 20 years and ongoing, but over the course of 20 years, Iceland invested a huge amount of resources, time, energy, governmental, non-governmental partnerships, everyone really around focusing on addressing what they had was a very, very high youth substance use rate. And they really, really focused on a variety of initiatives all around reducing risk factors and building protective factors. Obviously, like that was a national governmental, non-governmental partnership, massive in scale. But we looked at that model, we looked at other models, and looked at, of course, our own rural communities and our local realities, and built out a grant initiative that is really focused on again, increasing those protective factors for youth and reducing the risk factors to support them, with a focus on alcohol, tobacco, and marijuana use as high, sort of the highest use substances. And so we're doing that work in kind of two overall goals. So one is around working with parental caregivers, so parents and caregivers, schools, and community to increase awareness of what, of what protective factors are, risk factors are, and to increase the capacity to address those. And then also doing some direct evidence-based programs and implementing policies and practices. So what that looks like, some of that is, and this is for both Washington and Hancock counties, with a really strong emphasis in Washington County. Our project director is based in Washington County for this project, and lots of work happening here. So it's a $300,000 per year grant, and out of that, $100,000 per year goes directly to communities, to community partners, in as mini grants to support schools, towns, community-based organizations, to provide activities to youth throughout the year, evening, weekend activities in school, summer, to really expand the opportunities for youth to have healthy, pro-social, stimulating opportunities to grow, to develop, to find and develop, their meaning, their passion, et cetera. And then also mini grants to schools and community-based entities to provide peer-based mental health and social emotional supports to address the challenges that we know many youth are facing. So in the first 2 years of this grant, we were able to provide over 30 grants to different organizations doing really significant work in the communities. And the types of organizations funded include towns, schools, music arts programs, camps, scientific organizations, community-based nonprofits, et cetera. So a big investment into our communities, and that will continue throughout the 5-year grant, $100,000 per year. And then other programs are, we run a Down East Teen Leadership Camp, overnight intensive camp each summer, and we're able to support that to build leadership skills, positive factors, et cetera. And trainings for parents, caregivers, educators, et cetera, media campaigns to increase awareness of protective risk factors, direct resilience programming in schools, and more activities for families, et cetera. And then the next sort of big chunk of work we're doing here in Washington County is through the state of Maine, through the Maine Prevention Services Program, but a bulk of it is from the federal, is federal funding coming through the state to us to provide substance use. In this case, they divide it up between tobacco prevention services and substance use prevention services, which are substances other than tobacco. And we do a lot of work with partners, law enforcement, schools, towns, other partnering agencies, looking at environmental strategies and policy development and direct programming for prevention. And there's more I could speak about there, but I know we have limited time, so I might just kick it over. So lots and lots of work there as well. And ongoing, we think we're at the, we're actually at the end of a round of funding, and there'll be a process, but we're hoping that the state will continue to invest in that type of programming. So that's a little bit of an overview there, and I'll kick it off to Clem, I think.
Great. And I'm sure people have questions specific to the prevention. If you want to hold on to those, or just drop them in the chat, and when we get back to Elsie to talk about recovery, we can then kind of take all the questions at once. Thanks. So I'll pass it to you, Clem.
Thanks, Marsha. And thanks, Marsha did a really nice job of bringing Elsie and I together so we could coordinate and tag team as much as possible here. So if we've got some gaps, feel free to ask afterward or whatever. So I think as we got together and talked, we thought, maybe providing some of the information in terms of prevention, and then talking about treatment, which is next. And then certainly the aftercare components of reintegration and working in the community. A lot of what we did talk about was the area of substance use and substance use response, which is pretty significant. I think one of the reasons Charles was interested in both of our organizations talking today was as a result of some obviously SAMHSA funds, federal monies that have come in. And I will say that certainly very impressed at SAMHSA's response and others from a statewide level in terms of the needs of Washington County and really supporting organizations that are putting in proposals and looking for funding. So AMHC submitted two different proposals, two different SAMHSA proposals. One of them was the CCBHC, and I'll break that out and talk a little bit more about that. And the other one was the MAT expansion. These do cover our three coverage areas, so Aroostook, Washington, and Hancock. I'll talk just a little bit about the CCBHC, which is the Certified Community Behavioral Health Clinics. That is going to provide sort of a different philosophy and a different approach of community mental health services through our three-county region. That's going to be pretty much cut across all three of them, and we're going to see implementations that are going to really reach all three counties. MAT expansion, which I'll get to in a moment, is going to have a stronger emphasis on Washington and Hancock counties. That particular grant is about $2 million a year for 2 years. Started last month here and will run this year and then next year. And there's a lot of heavy lifting to do in terms of that. CCBHCs are known throughout the country. Actually, there's about 40 states implementing CCBHCs. Within many community mental health centers in the state of Maine, Community Health and Counseling and Sweetser have already started that process, and the state of Maine is looking at implementing CCBHCs in many of the community mental health clinics. Essentially what it does is it looks at the way we're providing services, providing higher accessibility to services, 24/7 access, looking at the timelines of responding to treatment, coordinating services, a variety of mechanisms that we look at within our own organizations and the way we deliver the quality of services that are delivering, gaining feedback from clients, developing an infrastructure to collect data, looking at outcomes. So it's a philosophy shift that probably leads from, I would say, that changes from the way we might have all done things historically, which might have been a little more siloed, and really trying to integrate that, not only in terms of the services that are provided by a community mental health center, but also the services that are connected with other organizations and agencies. One of the huge pieces of CCBHC as well is really strengthening the integration between primary behavioral health care, behavioral health care and primary health or primary care. And so lots of work bringing in staff as part of that, bringing in nurses, nurse practitioners, and lots of peer support. So peers are a strong part of connecting to the community. So a little bit of an overview. CCBHC started already, rolling out, bringing in a variety of resources, variety of staff resources, and taking a look at the systems and the way we provide services. Again, two other organizations in the state of Maine, and the state of Maine is really looking at CCBHC among many of the community mental health centers. So hopefully the goal is to really have a very different response, a more responsive and integrated response, specifically here in Washington County. I'll switch real quickly to the SAMHSA MAT expansion grant, which again, these services, both of these are really focused on the delivery of treatment services. And as we know, substance use challenges. As a matter of fact, we had a nice dialogue yesterday with Marcia and Elsie around, why is it that we're continuing the work and we continue to see some significant challenges? And that's not unique to Washington County. It's not unique to the state of Maine, and it's not unique to the whole country. There's a variety of significant factors that are playing into the fact that we're seeing a lot of increased substance use and a lot of increased overdoses, for example. And certainly one of the target areas, one of the challenging areas, is we're seeing more and more youth entering substance use or developing many substance use challenges at a much, much earlier age than we've seen, and more parents with very chronic substance use challenges. In terms of the SAMHSA MAT expansion, that one's a little longer term. It's a 5-year, which is great, gives us a lot more time to work with. And that one is similarly about 2 million, 2.5 million over that period of time. Again, affects the 3 counties. Aroostook County has some developed opiate health home models that will get some additional support. But in Washington and Hancock counties, one of the areas that we are focusing significantly is the continued work of the Down East Treatment Center, which has supported a lot of activities in Washington County as well. And that specifically works at providing MAT services to high-risk populations, to populations that have not been able to absorbed in other practices, and particularly utilizes the hub and spoke model. That was developed with community providers. Healthy Acadia was at the lead of the initial development of a lot of this work. It is integrated with hospitals, healthcare partners, so a highly integrated model that significantly partners with many organizations. As part of this particular project, we have converted the Down East Treatment Center to an opiate health home model, and reaching out to provide individuals that are uninsured or underinsured as well. Specific to Washington County, that's an expansion of providing additional MAT clinic services, expanding the reach and coverage that is currently provided. So the partnerships from community providers such as eSport Health, groups, RMCL, etc., Discovery House will all continue to occur. Our focus is not attempting to, it's really broadening the reach to high-risk populations. Within this is a specific focus as well in terms of reaching out to the jail population, which already occurs, but some of that funding is a little limited from the state, but to really to be able to provide added services, and especially upon release. So strengthening clinical services, here again, adding some nursing staff, increasing the number of peer supports, integrating highly with partners such as working with Healthy Acadia with recovery coaching and support services. So a little bit of an overview. I know that doesn't provide the greatest level of detail. That's a longer project, and really looking at expanding hard to reach populations, individuals that have not historically been successful in maybe some of the traditional MAT services, bring in a variety of supports within the clinic model and the community model, integrating primary care as part of that service in a new way. So a little bit of an overview in terms of that. Excited to see some opportunities in Washington County. If I can add just one more piece, one of the deliverables or the outcomes that we're looking at here. So there's a lot of data collection that's occurring as a part of this, is to really be monitoring and looking at the individuals that come in, and we have a goal of 50% of the clients to have significantly clinically improved outcomes. And part of those measurements will be looking at reducing recidivism rates, increasing employment opportunities. So meaning that they'll stay employed, they'll continue to be in the employment field or workforce, and also maintain stable housing. So we're looking at some of the broader indicators, hopefully to have I would say achieved or sustained outcomes over a period of time. Thank you.
Thanks, Clem. And we're just going to jump back to Elsie to kind of take us to the last part of that continuum and hear a little bit more about the other services.
Great, thanks. Thanks, Marcia. And I think I probably should have, I was worried about time, but maybe just to close the loop, obviously I live in prevention world as part of the work that we do at Healthy Acadia. And many of you probably are very familiar, but there is some really rich data and information out there that just talks about the incredibly powerful impact of prevention. It's hard to do because it's not that thing, it's not the crisis that's in the front of our minds, you know, or which is a real human, you know, tragedies and challenges. And yet, you know, of course, the investment is so incredible. So when we're thinking about economic health, community health, it's really significant. And the dollars that we have, you know, are much smaller than, you know, some of these big, like the Iceland initiative that I talked about. We're trying. There could be a lot more investment, and it is powerful. So, you know, as an example, the National Institute of Drug Abuse had did a big study some time ago, but it, you know, and talked about that each dollar invested in prevention has the potential to save up to $7 in areas such as drug use treatment, criminal justice systems cost, et cetera, and then not to mention the wider impact on the trajectory of young lives. There was an estimate, it's about 10 years old, but it was of lost productivity at work and in non-work roles in Maine due to alcohol and drug use disorder was in 2010 was 188 million was, you know, that they had quantified. And as we know, especially among youth, you know, the brain is developing until age 25. Those are, you know, and as Clem was discussing, I mean, when use starts young, the impacts are significant in terms of longer term challenges on ongoing substance use disorder. And also just in terms of the impacts for those young people, that youth are more likely to engage in high risk activities than adults when they're consuming alcohol or other substances, for example. And actually some recent data just really highlighting just in the last year or so around the epidemiological substance use trends data showing that adolescents who are consuming alcohol and other substances are more likely to have poor grades, be at risk for experiencing societal problems, depression, suicidal thoughts, assault, violence, et cetera. Things we generally know, but just that, you know, all of the ripple effects are so significant. And so that investment in prevention is greatly needed. And then going to Clem, the services he provides and are building out are so crucially needed. And as a partner in that work, a non-clinical partner, we have been able to bring in funds for recovery supports in the region, which is, you know, near and dear to our hearts and so critical to support our community members now who are struggling. So we are just launching a federal grant that will be $1 million over the course of 3 years, about $330,000 a year, from HRSA, another acronym, the Health Resources and Services Agency, as part of the Department of Health and Human Services at the federal level. And this is actually, there's a little bit of prevention, but primarily recovery programming and access to treatments. We aren't providing the clinical care, but we try to help people reach the excellent care provided by folks like Clem and AMHC. And so there's a broad areas of focus. Some of the highlights are around harm reduction. So, you know, maybe somebody's not ready to fully engage in treatment, but how do we help them be safer, right? And I think that is, I would say, Clem, I mean, when we were doing this work even 7-8 years ago, it was more taboo. It was like more on the fringe. And I think people are really embracing this work, which is so critical. It saves lives and it gives people a chance to more fully recover. So anything we can do to help folks reduce the harm, you know, we really, I think we've done a lot of work, Clem, or, you know, collectively, all of us to move harm reduction from sort of this thing that's like maybe a little bit criticized to like a part of the continuum of the recovery process. It's part of the continuum, and, you know, meeting people where they are and supporting them where they are to move forward towards recovery and health and well-being is so critical. So harm reduction work, anything from distributing naloxone to fentanyl test strips, helping make sure people know the substances, the lethality of the substances they're using, et cetera. Anything along that continuum is around harm reduction, doing work with school and community-based projects, addressing stigma, screening for infectious complications, training of healthcare providers, collaborating with law enforcement and other first responders to do some community-based work, support. There's some great opportunity to support our healthcare providers in maximizing reimbursement, which is like sort of dry, but definitely has an economic connection and has real tangible outcomes in terms of providers being able to expand what they can provide. And this was something that, was an option in this grant, among many sort of, there are do's and don'ts, right, of these federal grants, or allowable activities and non-allowable. And we worked, as we developed this grant, as with all of the grants we write, as Clem does as well, we worked very closely with partners, clinical partners, community partners, et cetera, and got, especially in this case, where we have the opportunity to bring funding in to support, among many other things, our clinical providers, FQHCs and hospitals. We said, what would be helpful among these allowable activities, and they helped guide us to prioritize certain areas. Similarly, with our law enforcement partners, our municipal partners, et cetera, we said, we reached out to multiple partners, to Clem, to others, to say what would be most helpful here, and we're able to dig in and prioritize what our partners said would be helpful. So that's one area, maximizing reimbursement. So like literally paying for audits, internal audits for an FQHC to find out where they can be billing in ways that maximize their reimbursement, so that they can actually they can actually be paid more appropriately and in a better way for the service, the substance response services they provide. That was a big request. So we're excited to be able to do that as an example. There's also coordination of services upon discharge from jails and other institutional settings, increasing peer supports that then, ties into the work that Clem's doing, so we can support his work and that others are doing. So a lot of it's very interrelated, and all with the goal of decreasing mortality from substance use disorders and increasing and supporting recovery and well-being. So this project is brand new. We're particularly excited about being able to reach out to people in a wide variety of settings, schools, dental practices for screenings, childcare providers, child protective, more. So that's that. And then another grant that we're just launching again, so just launched beginning of the summer, is also from HRSA, so the Health Resources and Services Administration. And we created a mouthful of an acronym for ourselves for the project initiative, for better or worse. Again, this was actually led, we were approached by the hospitals in the region and EMMC, who wanted to find a way to better support our local hospitals, to do more for women, pregnant women, when women with babies experiencing, so the women experiencing substance use disorder, supporting them from pregnancy through early childhood, so through age 3 of the child, building off of some great, really interesting models in different parts of the country. So as you may or may not know, many of those women traditionally would have to go to Bangor to be treated. So EMMC has developed a very robust program to support women with substance use disorder, particularly opioid use disorder, to support them. And actually the folks at EMMC, as well as our local partners, said they were excited about building out the local capacity and infrastructure here in Washington and Hancock counties. And so asked us to serve in a convening role for the grant. And so we got that. Our initiative is called PROSPER, which is, the P is for pre, peri, postnatal, and parenting. Resources is the R, and other support systems for pregnant women and families engaging in recovery. So it's a mouthful, but it does describe what we do, and we liked the acronym. So usually we just use the acronym, but it's really around supporting those families and women and families, and helping to break the cycle. So supporting those really strong early childhood developments, supporting the parents, supporting the infants, in partnership with amazing organizations doing similar work, and supporting the clinical providers to be able to do more of that. So again, that involves a lot of like work convening, but a lot of the expertise. EMMC will be working with local hospitals, we'll be providing community health navigation, training, et cetera. I know I see Marcia jumping in, so I'll just say in 10 seconds, 2 other items that are sort of big, but a little bit more on, so state funded with some federal funding coming through, that sort of ties together is Safe Harbor, as some of you may or may not know, is our recovery residence for women and children in Machias. And we're just we've just had 1 year. We've provided support to 12 women and 10 children since opening. And so it's for women and their children, with or without children, in recovery. And so lots of there. And then recovery coaching, we actually have been able to build out recovery coaching training and coordination and supports peer coaching in Washington County, as well as 10 other counties in the region. 8 other counties in the region.
And Elsie, I'm sorry to cut you off, but I see there's a lot of great questions in the chat already. And I want to make sure that we get to those and probably others. I think, Jesse, why don't you start? Because I can't even see them all on my screen right now.
Sure. The first question is from Lori Joy, and she asks, are there any supports for people getting turned away from the emergency rooms while detoxing?
I hadn't seen that one in the chat. Thank you for picking it up. That's great. Actually, we had an excellent conversation about this yesterday. Was it at our meeting? Goodness, I can't remember which one it was. Where we had a nice dialogue in terms of that. So the question, as I understand it, is what are the supports for individuals that are attempting to access detox from the emergency rooms and are potentially getting turned away? Is that actually, both of our organizations are involved. Healthy Acadia has historically done a lot of work, but both of our organizations have partnered a great deal in terms of taking individuals in as soon as they've started a detox regime from the emergency room. But actually what I'll do is I'll turn it over to Elsie, who can talk a little bit more about the role of recovery coaching in the EDs and the need to support them right away, especially supporting with detox. And then we could talk a little bit more about some of the alternatives to ambulatory, to regular traditional detox or ambulatory detox. So please go ahead, Elsie.
Okay, I was thinking maybe we should dive into the clinical piece, but I'm happy to. So, and I think you were talking about the afternoon meeting, which I wasn't able to be at Clem, but so you can.
Oh, okay. Sorry, I can't remember which meeting.
No. So one thing. So when we think about detox, so one thing is hospitals and Clem. So non-clinician. So Clem, you can correct me or whatnot. But with alcohol, there's a very real medical harm of detox. So if somebody is in that situation, they will be kept in the hospital if needed. With something like opioid detox, it is not necessarily, it's very, very, very painful and very, very difficult and excruciating, but you don't technically need to be inpatient. And so, well, and Clem might talk about this more, with medication assisted treatment, you actually can start that without having been fully detoxed. And so there are ways to get into community-based treatment sooner than a full detox if you're interested in that kind of service. And in terms of our programming, we have been working with the emergency departments in Washington and Hancock counties, as well as other counties, actually, with our recovery coaching program. We do offer coaching at any stage along the continuum, like we talked about before, from a harm reduction stage to a detox to an early recovery, long-term recovery, whatever it is. And so, it's a continual process to get better and stronger referral systems, et cetera. But our recovery coaches, peer recovery coaches, are there to help people each step of the way. And we have also piloted at various times sort of community-based detox options. But now, especially with the prevalence of medication-assisted treatment, recovery coaches, whatever, there are a number of community-based options, especially if we're talking about something like opioid withdrawal. I don't know if that starts the conversation off. Clem, do you want to jump in?
Maybe we can just wrap it up, because I know there's a variety of questions.
Yeah.
I think Abby was at the Washington County Substance Use Response Collaborative where we had it. But the bottom line, to have a level of sensitivity to the emergency rooms, though, they are dealing with a lot currently. There are lots of COVID challenges. They have a lot of individuals for psychiatric hospitalizations, adults and children. They're overwhelmed. They are tapped out. They're finding it really, really difficult. They don't have as much bandwidth as they used to. So we do see a lot of individuals go in the emergency room or attempting to, and they're turned away. I do think we need to develop more, I'm going to say, ambulatory detox mechanisms. Same thing with residential detox. Lots of challenges there, limited staffing challenges, fewer beds. And so we need to come up with some creative ideas. But anyone who's able to get, and some people do get into EDs to get some startup MAT or detox protocols.
So there's a group of questions here that are about community-based prevention activities. So rather than read them all through, I'm just going to kind of highlight the pieces. But certainly there's questions about what are the most important social determinants of health that is going to help prevent a young person from misusing. I think there's a question about community strategies when we have limited law enforcement resources, and then just about some of the barriers that you see to reaching young people. So we'll stop there, and then there's one more question about work readiness and job training.
Clem, do you want to take it first?
So I think one of the questions I read through, one of them is, what are some of the social determinants of health associated with young people? And then, is there a mechanism of attempting to curb or manage the high substance use or drug use in our communities? I think maybe we can split it up in two areas. One of them is, in terms of there's the supply, demand, and working with individuals. And much of what we do as our organizations is, how do we provide some prevention information, education I'll move along quickly, so that individuals are not starting in sort of the drug use initiation component, I guess. Law enforcement's role is the supply reduction. But in terms of the work that we do, from our perspective, it's a great amount of treatment work. Healthy Acadia's perspective, a lot of prevention work. And then after we have done both of our pieces, a lot of follow-up and aftercare. Harm reduction, huge part of that to help people along. So I can turn it over to you, Elsie, if you want to touch a little bit about the prevention work and social determinants of health.
Yeah. Oh my gosh, these are such big questions. I'm not even sure where to begin, but yes, there's so much to be done, right? There's a question around sort of like, what are the social determinants of health that are most impactful? I mean, I think, when we think about, way upstream, like, we know how critical the first 5 years of life are, right? To brain development, to social emotional development, et cetera. And of course, that's not the end, right? Our brains are plastic, and we have always have opportunities to recover, to heal, to grow. But of course, if I had a magic wand, like every child would grow up in a calm, connected home where resources were readily available and accessible, and there was, just lots of love and support and calm and resources and opportunity, you know, and life was full of potential, right? Like, and obviously that wouldn't fix everything, but that, you know, and the world in which we live, like resources are not plentiful, and there's an abundance of stress for parents, you know, you know, there's, and let alone like sort of, you know, and there's a lot of opportunity to practice calm, every single one of us, you know, and just a lot of challenges that lead, you know, the ACEs, the adverse childhood experiences, you know, are so impactful, both for physical health as well as for emotional health, for, you know, for what we expect to see, or, you know, or for the risk factors around mental health challenges, substance use challenges, physical health challenges. So, I mean, you know, there's a lot of work to be done there. Huge amount of work. And then, you know, as we move through the years, right, or youth, you know, teens, early 20s, like lots, a huge amount of work to be done there. Joy, I think somebody mentioned depression and anxiety is enormous, and it just seems to be growing and compounding, you know, between economic struggles and COVID and, you know, sort of big picture, global or local stressors, trauma, triggers, you know, there's just a huge amount of challenge, you know, and for a young person to, you know, feel connected and a sense of belonging and a sense of potential, right? I mean, those are such critical things to choosing, you know, to choosing healthy paths versus risky paths. And so those are that's sort of at the big picture level, and but then how does that connect to the community, and what do we do on the ground with the limited resources we're given, is, you know, we're running out of time, but is where obviously the rubber meets the road. And I'd love to have more, you know, these are the things we think about a lot, the things we try to inform the work we do in the community. And there's so much more to be done. Stop.
Oh. Any last, like, how should people connect to you? And Jesse, can you save the chat so we can make sure all these questions get responded to?
I'll put my, probably people can just find me online, but I'll put my email in here.
I'll do the same. And I just want to add, there are people in this room here who have mega experience and many areas more than Elsie and I. Abby is here. I'm seeing a variety of folks, and we happen to be sharing information. But I think that if we take a look at some of the challenges in general, we see a lot of parents that are having substance use challenges, and you'll see the Department of Health and Human Services identifies that more and more children in care. Subsequently, we have more and more children that are affected